Now we're going to talk about shoulder separations, which are also called AC joint injuries. But in order to talk about an AC joint injury, we have to talk about the clavicle. The clavicle, or the collarbone, is the only connection to the axial skeleton. Well, what's an axial skeleton? Well, if you put your hand on your chest and feel the joint next to the sternum, this is the connection we're talking about. This is something called the SC joint. And you see it here on this diagram. The clavicle then is a tubular bone that stretches from the SC joint out to the shoulder blade, which is also called the scapula. At the point that the clavicle attaches to the scapula, it meets part of the scapula called the acromion. And that joint is called the acromioclavicular joint, or AC joint. Now, all joints are held in position with ligaments. So when a bone meets a bone, we call this a joint. And what holds the joint in position are key ligaments. So at the SC joint, there's a set of very strong ligaments. And at the AC joint, there's two sets of very strong ligaments. So now that you've seen what the AC joint is comprised of, now let's talk about shoulder separations and AC joint injuries. So the key thing to note on this diagram are the ligaments at the AC joint and the ligaments that hold the clavicle to the coracoid, and these are called the coracoclavicular ligaments. Now don't get lost in the names of these ligaments. They're two sets of very strong ligaments, and depending whether you've injured one set, the other set, or both sets, depends what treatment will be chosen for you. So the grading system for deciding what level of injury you have starts at a level 1. A level 1 is an injury to just the ligaments of the AC joint. A level 2, which often shows up as a little bump on the shoulder, has ligaments to the AC joint and partial injury to the CC ligaments. A grade 3, which is very common, has injury to both sets of ligaments. So let's just talk about a grade 3 for just a moment. Since grade 1 and 2 do not require surgery in any circumstance, but grade 3 can require surgery, what situations is surgery appropriate? Well, the shoulder functions normally, even with a grade 3 separation, for most patients. But there are certain high-demand patients where that's not true. If you're an overhead athlete, an NFL quarterback, or an overhead laborer, your shoulder may not function the way you need it to. And those patients will often choose to have the ligaments reconstructed. There are higher grades than 1, 2, and 3, but every grade higher than 3 involves the clavicle being in a position that's not close to its normal position, and those all require surgery. Fortunately, those are all rare injuries to encounter, and most patients will be treated non-surgically, since most patients' injuries are grades 1 and 2. Now, grade 3 sometimes is treated surgically in someone who is not a high-demand athlete or laborer, and this is something that patients often choose when they don't like the way the injury looks. But just a word on choosing surgery for a grade 3 shoulder separation if you're not a high-demand athlete. Essentially, this is a cosmetic procedure, and I always caution patients that surgical risk is a real thing. And so considering what the outcome will be, which is a better looking shoulder but not a better functioning shoulder, is something I make them think long and hard about. The good news is that most AC joint injuries do not require surgery.